Solanaceae is a large family of plants, of which only a few are edible. The most common are tomatoes, aubergines, potatoes, and peppers of all types and colors. They are part of the regular diet of many people. And the truth is that, like any other vegetable, they are rich in vitamins, minerals, and other beneficial phytochemicals. However, they also have some drawbacks that you should be aware of if you are sensitive or allergic to solanaceae or suffer from certain health problems. The possible harmful effects of solanaceae are mainly due to the content of 3 compounds. One of them is calcitriol, the most active form of vitamin D. This powerful hormone activates the absorption of calcium from food by the intestine. For this reason, its production is very controlled at the renal level to avoid excess calcium in the blood. Due to its calcitriol content, excessive consumption of solanaceae can lead to hypercalcemia. If this happens, our body responds by depositing the excess calcium in the soft tissues in order to avoid greater problems. If hypercalcemia becomes chronic, these deposits will gradually increase over the years, causing stiffness, inflammation, and joint and muscle pain. The second one is solanin. It has a toxic effect on animals and plants. In fact, solanaceae produces it as a natural fungicide and insecticide, as its bitter taste prevents them from being eaten. Potatoes and aubergines contain the highest amounts. Solanin is toxic because it alters the neurotransmitter that regulates muscle contraction and relaxation. As a result, muscle contraction is prolonged, leading to muscle spasms, weakness, pain, or stiffness in many people, especially when standing up or after several hours of sitting. It also alters the cell membrane of the digestive tract, aggravating the symptoms of irritable bowel syndrome, and may lead to, or aggravate intestinal permeability and inflammatory bowel diseases. The last one is histamine, which is found naturally in many foods, and if your gut is healthy, it can degrade it without any problem. However, in people who are unable to break down food histamine properly, it tends to accumulate, producing a variety of symptoms such as 1. Rhinitis, itching, sneezing, and nasal congestion 2. Diarrhea, constipation, nausea, and vomiting. In these cases, it is necessary to start treatment and follow a diet low in histamine, avoiding solanaceae until the underlying problem is solved. We would like to hear about your own experience with this topic. Leave a comment. Lastly, remember that it is important to talk to your doctor or other professional before beginning any sort of supplementation or treatments. Feel free to contact us if you want us to give you the contact information of professionals who work with our network.